We are going to discuss about the 24 elements Vedic model, and to understand this model. Yes, Anurag sir.
Put in presentation mode. Yeah, now it is okay.
Okay, yeah. So today we are going to discuss the 24 elements Vedic model. So nowadays we are using lots and lots of gadgets. So it's very easy to understand the gadgets work, human body also work the same way. Say for example, pick up the one mobile. Mobile is already having their own software, and because of that software we are able to use that gadgets, and we can download apps, photos, videos. The same way our mind also work, and it has also a own software, and that software we call the 24 elements Vedic model, and it is made up of forces, and these forces are having a language. The same software is running the mobile, the 24 elements Vedic model forces in a form of language. It is already designed within the human body. If this software is not present in our body, we cannot work. So, if we understand the basic fundamentals of our human working, we can handle lots of problems in our life, basically, and we are having a clear vision what to do and what not to do, basically. So in our children's, particularly who are suffering autism, ADHD, learning disability, genetic disorder, and lots of other problems and disease in our life, that is because this software is somewhere got infected with the viruses, and those viruses are what? Those viruses are our emotions, our conditions, our belief systems, our negative experiences, and it has a so profound effect. Sometimes they break our system. We can say that's the software, and that software is a 24 elements. And if the software is not able to work properly, we cannot handle our life to be a human beings. So we need to understand these things thoroughly, and this is the basis of human working, human existence. If we do not have this software, this body cannot work. Same way, if your mobile get infected with virus, your mobile cannot function. The same way human mind cannot function. So we need to find out what is the effect of your emotions, your thought patterns, belief systems, or your any kind of traumatic experiences who has breakdown this system, and the system has gone into a failure. So in a gadgets, we change the gadgets, but in a human beings, we cannot change our body. So we need to fix it one or other way. And many of the parents has tried many approaches, and to be a therapist, I have also tried many approaches, but after studying a lot of things, I have found that the Vedic model, which is already given in our Vedas, is helping us a lot to bring back these forces into a working condition. So, if we work on these forces, if we again make our software workable, we can perform in a better manner. So, friends, this is the model. This is the basics model. There are a lot of concept is given in a Vedas, but this is the easiest approach I think someone has designed, and it's very easy to understand. So many people are jumping directly for the speech therapy, for the educations, without going a step-by-step procedure. So by this model, we understood that how this information we can process. And in psychology also, it is given that the first we sense anything and then it goes to a short-term memory, then it goes to long-term memory, then whatever the programs within our mind, we match with that program and we come to some calculation what is right and what is wrong for us, and that is our cognitive abilities, and then we give some actions. So this model exactly works the same way, easy to understand and easy to apply. So always from environment we gather information. So always the sense organs come first. We smell, we taste, we see, we touch, and we listen the sound. So these kind of sensory informations we gather from the environment, and all these sensory systems is connected with our knowledge acquiring senses that is in a physical form. So we understand the physical form basically. We can see our nose, we can use our tongue. So physical phenomena, it's very easy to understand for us. If we are having an intact ear, then only we can process the sound. Same way the skins should be intact because there are a lot of sensory organs beneath the skin. Eye, it's a huge sensory system. Tongue, we can test by tongue. So all kind of tests can be tested by only a tongue, and nose for the smell. So this is our physical organs. In day-to-day life we use, but still we are not understanding how the human body function physically or mentally. Okay, so by these organs, we gather information from the environment, okay, and then it goes to a mind. Mind has a memory. Then all the information we have gathered from the environment, we match with our old information. Then all informations make some structure within your mind. Then intellectual decide what to do and what not to do, and what is useful for me and what is unuseful for me. Okay, and then it gives one some kind of response that is called personality. That false ego is a certain kind of personality, and it's always needed to give a certain kind of response. Okay, and then we take action, and action could be a speech by legs, by arms, by reproductive organs and evacuating organs. These five basic functions are always needed, and it should be in a functional manner. Then only a human mind could be in a functional manner. Okay, and these gross elements, that's ether, air, fire, water, and earth, is a gross elements and like a memory system. These all the memories are stored in this area basically. Mind has a soft copy, intellectual has a capacity to understand the things, false ego has a copy of our personality. So this is the basic systems how we work basically by using these elements. I think this much is clear for everybody and it's easy to understand. Hello, anyone can reply me back. It's easy to understand what I am saying, how 24 elements Vedic model is working.
Yeah, I think for a reply,
Keep it interactive, please. So,
I can see.
yes, it's easy to understand.
Yeah, it's easy to understand everyone's saying.
Okay, okay, fine. Thank you. So, first we sense everything from the environment by smell, by taste, by sight, by touch, by sound. Okay, and this is the our physical organ. If it is present, then only we can sense the organ. Then we will make a copy in our mind. Then we will decide what response we need to give. And we do have a certain kind of personality according to our memory. And then we go for a response. And response could be a speech, by legs, by arms, by reproductive system, and by evacuating organs. So these are the forces. Okay, then how it get disturbed and why it is not working, now we will discuss on it. So this is the structure. This is not the physical body. These forces are not the physical body. This is the software. Whenever we use mobile, we are not understanding the which kind of software is working, but we are able to run the mobile. The same way we are having a software in a form of these forces, and it is very structured and beautifully designed energy which can run your human body. Okay, so this is the basic design I have given. It's a huge design. So we are having all the 7 chakras. We are having a 3 nadis. This is the Susumna Nadi, and we are having a Ida and Pingala Nadis. Okay, and one is the moon energy, and one is the sun energy. And if you pierce the Susumna Nadi, you are having a knowledge about who you really are. So it's about who we are and how we are functioning. If you want to understand, we need to understand our software. If we understand our software, if we understand the language of our software, we can run it in a better manner, and we are having a very clear vision how to live on this planet to be a human beings. Okay, so this is not the physical body. So some people are saying that they are not understanding these things. You need to work a lot to understand about your software. Sometimes we are not even understanding our physical body. Energy body is a very different phenomena, and you need to go on a deeper level to understand the how the software is developed. And our spiritual masters every day saying about this, and India, and in every corner these people are making us understand how to live a life. They are doing a lot of things behind us for a better human society development. So these things we have put it into a practice, and it's with very easy methods. Nowadays, we do not have to go to Himalayas, but within a one room, you can shift your software and you will get the experience of Himalayas in that place. So we are bringing this therapy in a one room from Himalaya to our clinics or wherever you are sitting. We can evolve anywhere in any corner where you are sitting. Okay, so I think this is the clear. This is not the physical body. This is the energy body. Okay, then these forces are developed and it falls gradually, and we all are having a knowledge about the Prakriti and Purusha. We can say Shiv and Parvati, Radha and Krishna. So it is the male and female energy basically in our language. But when you go beyond, Radha is the Krishna and Krishna is the Radha. Now Shiv is the Parvati and Parvati is the Shiva. That is the oneness state. There is no difference between a Shiva and Parvati. So this is the two force basically, sun and moon, moon and sun. When they are in a single power, then our Sushumna Nadi gets activated, and we can understand the software and language of the universe, how the human body has designed physically, basically. But without software, the physical body cannot be developed or designed. And then gradually all these forces come into this, whatever the 24 elements we have discussed. So these part I have not covered because this is the 36 elements basically. Right now we are discussing only 24 elements. First, I want to understand the basics of our existence and where we can use this model for health, the psychological issues, behavioral issue, speech problems, organ health, cognitive development, eye perception, whole sensory system, support for the cancer patient, fear phobias, hormonal imbalance, anxiety, hyperactivity, all neurological disorders, children's and adults, women's health, fertility, immunity problems, and there are list is on, because if these forces get disturbed, then only it will create a disturbance at the physical level. And as a doctor, we work on a physical level, but now we are trying to match that. We can work on our software as well as we can work on our physical body. So we are having a better results than a normal conventional way. What Vedic principle, what kind of principle I have used? There are multiple principles we have used, but the few which is the major that I have discussed here, that's the Vedic principle already we discussed, that's the 24 elements. Then we have used lot of theory of psychological issues, what kind of symptoms are there, what kind of approaches are there, and how can we convert these approaches in an easy manner to using this energy, we can apply it. A theory of neuroscience, how the energy and consciousness working. There are lot of research about the neuroscience and consciousness. So we have used the principle of the neuroscience and the theory of quantum physics. Quantum physics is a total consciousness, and nowadays lots and lots of people are working and in research area, and we need to find out how can all these principle we can use for a human health. Basically, I am using for health, and lot of people are using it to manufacture human machines in a medical science and other areas. And in future might be we have something like digital that you can just put your hands and fingers like a mouse, and the other person is somewhere else. They will read your body and they can correct it, whether it's physical or you are in a distance manner. Both will be possible, and lot of other research are going in this area. And nowadays, if we are having a fever, then we use a paracetamol, and it's a general medicine. In future, might be you are having a one-to-one medicine. What the approach we have now created, we read the general body affected, and then you give these approaches, and we design the program. The same way in future, we are having a solution for one-to-one. That's we are going to use in this 24 elements Vedic model. Whatever the kind of problems, we find out for you only, and the solution is for you only, basically. So in future, we are having a lot of research will come, and this model is continuously evolving. because whatever the research come in front of us, we are going to change our method of application, and we can give a more and more benefit to our children and people who are attached to us. So already we have discussed that we are physical body or energy. We are both basically. Energy is our software, and the physical bodies what we are every day using. It's like a mobile. It's very easy to understand. Software we are not understanding, but still we are using our mobiles. Okay, so it is a physical, but software we cannot handle. The same way energy is such a thing that it is the software, but we don't know how to handle our software, and that's why we are not able to handle our physical body. And this is the energy particle from within. We are energy, and there are lots of research are going in a quantum physics. Even you can find lots of videos. At the end of the day, they have researched that we are just a single vibration only. If we shift our vibration, we can shift our software, we can shift our physical body, what the productive response we want for our life or health, we can shift it. Okay, and for that, we need to understand the language of the universe. And language of the universe is the celestial sound, basically. And that celestial sound has a powerful phenomena that can shift this vibration. And shifting this vibration, you can evolve more, and you can even change your health and even a vision towards your life. And principle of quantum physics, just I have given a few, that uncertainty is a principle. Is uncertainties why? Because whenever we get such a kind of environment, then only the seed of good or bad experiences start growing. It's like a seed in a soil. If the rain comes and then it grows, the same way our experiences are already there in a mind, and whenever it gets the environment, then only it grows. Till that they are in a dormant condition, like the seed is in a soil but it's not growing. Whenever it gets environment, a good nutrition, good soil condition, sunlight and rain, then only it start growing. Same way, if we get the environment, whether it's a positive experience or negative, if the positive experience is there, then we will evolve. If the negative experience is there, then it's degrade human beings. And then wave particle duality, then entanglements. Wave particle duality is that any particle is in a moving condition. Basically, it's not in a stable condition. So always we are on a moving, and we find also that in the last hour you were thinking something else, and in the next hour you will thinking something else. So our mind is in a movable condition. It's not in a stable condition. If you get so stable or stuck, then we already facing that our children are not learning anything. They are having a fixed kind of behavior. They are not moving from a certain point. They want a certain kind of environment. They are very rigid in the daily activities. That's because their mind is not in a movable conditions. It's stuck somewhere. It's same way like the car is not running, it will get destroyed. The same way, if the mind is stuck in a one manner, it can never be evolved. And then comes to entanglement. Entanglement is just one person is attaching with the another person for some reason or for some purpose, basically. If its purpose is a spiritual, evolving, then we benefit each other. And if it is a purpose, we can say that I want something from you, that kind of lower kind of purpose, then we get damaged by each other. So what kind of attachment you are making with each other, that is important. And that first Attachment is how you are attaching yourself. That is very important. Then you are attaching with your family, then the society. So what kind of relationships you are making, that is very important to evolve and get a better experiences. So always your approach to another person is a very important. Your approach to self is a very important. So uh, in the Vedas, it is written that Vasudeva Kutumbakam. If we approach the whole world on a Vasudeva Kutumbakam, then it will be a more beautiful approach that we do not have any trust issues or any kind of lower kind of intention with the humanity. When you approach in that manner, we always evolve together. I am helping you and you are helping me. You are growing and I am growing and we all are growing all together basically. Okay, so these kind of principles of a quantum physics we have used for the health and purpose to be a human being. Superposition is it's kind of the things when you are having a one experience, then second experience, then third experience, and somewhere you are grow in your experience. If your experience is beautiful, you evolve, and if your experience is negative or degraded, then you go below the line where you cannot handle yourself, and that's our children are facing basically. So we need to work on it so they can come out to their normal position or normal phenomena, normal power to lead or handle their life. And this is the Freud's theory of the mind, where he has given a three kind of mind. That's unconscious mind. Unconscious mind basically studied by a spiritual person. Unconscious mind studied in a psychology, but depth of the unconscious mind is in a spiritual aspect only, whatever the study up till now I have done. Then comes to a preconscious mind. Sometimes we are talking something to a person, but back of the mind there is another thought and feeling. That is your subconscious mind. Sometimes we are angry with that person, but we are not showing our anger. That is in your subconscious mind, but that anger is not damaging the person whom you are talking. But if the anger is developed within you, that anger will always damage you, because whatever happening is, that is happening in your mind. So always conscious before giving any kind of responses. Think first before going for any actions basically, and try to understand sometimes whether you do not like that kind of response, but by communication after 5 or 10 minutes, when your mind gets settled, if you communicate, might be you come to a better solutions. So don't give a direct response. And our children's are in design in such a way, they are having a fixed structure. If they are having any negative behaviors, they are just in a reaction mode, because they are not understanding logically, because all the forces are get damaged. So we need to come back to a normal, and we need to release our forces, and that release our mind, and they come to a better solution, and they change your behavior. So our children are basically working at the two forces only, that is unconscious and pre-conscious. Consciousness is a very less, so they are logically not taking any decisions, and that is our cognitive development, because we are running on a program. You can say for that memory is fixed, and one cassette is running within you, and you are not coming out of that cycle. So you are not getting any new experience, and you are not able to upgrade your software. So if gradually we release both these mind, the child will come to such a situation, they understand the things at the conscious level, and they come to a situation where they can participate logically little bit also, that will also help a child and parent both. And that is the percentage of minds how we are working basically. Unconscious is 30 to 40, subconscious 50 to 60, and conscious mind only we are using a 10%, and it should be a more basically. If consciousness raised, all these parts this is basically a memory actually, unconscious and subconscious memory, and that's program memory only we are using. And the Vedas are saying that you need to work on a conscious level basically, and you need to erase all these memories. It's a negative and it's not fruitful, then we need to work on these memories basically. And mind is just one force, as we have discussed, that how we sense that, and then it comes to a memory, and then that copy developed in a mind, and then intellectual, cognitively, we decide what kind of response we need, basically. So just do not jump onto a mind. We need to work on a sensory system, then all kind of memories, then we can shift the mind, and then we can shift the cognitive development. And in the neurology, that's the green part is our frontal brain, and this is the logical brain. We need to reach at this part, then only we can work on a higher cognitive level, and that is our consciousness. Basically, consciousness is not a physical, but your experience is that is processed by this part of your brain, and brain is just this organ, like we are having other organs like the kidney, liver. The same way brain is an organ, but function of it to process everything on a physical level, and then we can reach at some calculation. And this is our limbic system. And this is about all our emotional parts, what we are feeling. We are angry, we are happy, we are feared, whatever kind of what it is, everything is processed by this part of the brain. And according to it, we are having a chemicals that we call hormones that will communicate in our brain areas, and accordingly we give our working response. So hormone is a very important, whatever the sensory experiences are there, you release that kind of hormone, and that hormones then gives a message on a physical level, and according to that we gives responses, what kind of response we need to give, whether it's helping us or it's damaging us. And then comes, this is the reptilian brain. This is the survival brain, basically. And this is the most unconscious memory. And this is the deepest layer of our memory, that is unconscious memory. Whenever the child gets born, we never have to teach them how to walk, how to talk. They gradually engage and they realize that who am I, who are my parents and my family, and gradually we grow. That is designed in this brain, basically. That is the reptilian brain. And we need to understand in 24 elements Vedic model, what is our first program, basically. And our first program is that the I am one, let me become a many, and that many are the human beings. So this program is in this brain, and we need to reach at that program for a spiritual ascension. If we go understand for the therapeutic purpose, then we need to understand that whatever the program at unconscious level is damaging you, we need to release it and free that force to function in a better manner for you. And then there is a midbrain that's on motor control, hearing, vision, pain control, sleep-wake cycle, and sensory perception is governed by the midbrain. Then neurology, PONS function is controlling the breathing, sleep cycle, pain control, taste, vision, hearing and balance, coordination of movement, a sensory system and bladder muscle control. That's your evacuating organ. And medulla regulate your BP, breathing, heart rate, right side of the brain control the left side, reflex like coughing and swallowing, motor and sensory signals, and connect the spinal cord and pons. So what is the cognitive development? Cognitive development is the sensory information processing by mind and neurology, and that convert into a meaningful information, and then we take action. So I have discussed initially that how 24 elements forces work, that first we sense, then we decide, and then it comes to a cognitive development, which is either stored in a short-term memory, long-term memory, or working memory. Once you learn walking, talking, you never forget until this information is destroyed. The same way our experience is stored in a negative form, then destroyed our forces. So we need to work on it for a better cognitive development. But how this information get distorted? What information you are gathered by, distorted by your emotions, thoughts, any incidents in the environment, genetically negative self-experiences can change your structure of all these forces. Physical accidents and trauma even also have a capacity to change this information. And these kind of things we see that when the child or adult are having head traumas at that time, sometimes they lose their cognitive development even. If structure change, what happened? Behavior can be changed, hormone can be changed, sensory system can be changed, motor system can be changed, cellular level even we can change, and change in a posture system. Behavior distortion look like this, and then that we all know. Distortion in a sensory system, that many children we find that some kind of eye issues. Sometimes children are not attentive. So all these kind of things happen in the sensory system. At physical level, structure can be destroyed in this way. If this structure is not rigid, we can even change with this model. And if the rigid structure is there, then we need to go for a surgery, and then the child come for the exercise. Distortion happen anywhere: organ, brain, liver, kidney, muscle, bone structure, hormone, cellular. What kind of memory is there? It can damage your body according to it. Role of nutrition, that magnesium have more than 300 function in a body. We use it for neural plasticity. We need a good amount of magnesium within our body that can maintain our plasticity of neuron. As we find that our body sometimes get rigid, we are not able to bend. That's the rigid nature of the body. Same way in a neuron also, if they are having a no plasticity, then it will not work in a better manner. So we need to understand the importance of nutrition also. And all kind of vitamins, minerals, protein needed for the function of brain and body. So nutrition is very important. So this is the magnesium we have designed. If we need it in a child, we check it and then we provide it. So it's easy for us. At physical level, neural plasticity is maintained. And this is the customized affirmation water bottle, and that's the positive affirmation, positive words. You drink that water and that feed your system in a positive manner. And effect of words on water, what kind of words you are speaking, that can design certain kind of structure. So Words are very powerful. Use it precisely, then only you will get the benefit of it. And someone has done a research on it, how the water behave if you use a certain kind of word on it, and this is the design. So all these better structure design are the positive words, and this is the negative words, and that destroy the forces basically. So we need to understand the power of language. Language is very important. Whatever kind, it's within your mind or verbal or in form of intention, but it must be a positive, otherwise it will destroy you first, and gradually we are not in a functional manner. And we use the herbs, certain kind of herbs we use to clean the system on a physical level, and it's very helping our children, and sometimes it helps us to shape their behavior also. If the, we can say, liver is not functioning, if their gut is not functioning, if the constipation is the issue at that time, they can create a issue in a behavior also. So that's why we are using herbs to keep the system working, so they can process the information in a better manner, and they can give a better output in a form of behavior and neurological development. Okay, the balance 24 elements, we are having such a beautiful life. And this part I am ending here, and then we will go for example. In between, if anybody want to ask something, we can clear a question answer regarding 24 elements, and within a 10 minutes we just go.
So I have unmuted everyone. Anyone can unmute himself and speak.
Ask one thing, madam. So we should work on subconscious, conscious thinking only, then it will be better, correct?
हिना जी, आपको अनम्यूट करना पड़ेगा. आप अपना प्रेजेंटेशन क्लोज कर सकते हैं या फिर स्टॉप शेयरिंग कर दीजिए.
हेलो.
हाँ, 1 मिनट सर, 1 मिनट. हिना जी, डॉक्टर हिना, आप अपने प्रेजेंटेशन को स्टॉप शेयर कर दीजिए और अपने को अनम्यूट करिए. स्टॉप शेयर. हाँ, स्टॉप शेयर. हाँ, right.
Stop sharing I did.
Okay.
Okay.
Yeah, that is okay.
Yes. Yes. What is the question?
Hello, madam.
Yes.
I am Divakar.
Yes.
And you have made a very beautiful presentation on this. My question is that how we can apply it for the benefit of intellectually disabled children.
How can we apply this model to intellectual children?
How we can apply this to the benefit of intellectual disabled children who are having behavioral issue, speech problems, and understanding problems.
Okay. Look, that understanding we have discussed in the 24 elements, that's the intellectual, that's we call a buddhi in a Sanskrit. And the working memory we discussed, that's the speech, right? That two things you understood?
Yes.
Okay. And we need to find out in 24 elements which force is not working for you. Okay. So in speech is an ether element basically. And ether elements we need for a sound. If the ether elements is charged with your emotions, thought, or certain kind of experiences, then it cannot produce language basically.
How we can correct it?
Okay, correct. Are you getting me? And
yes,
now
I'm getting you.
Okay, and now any single force is charged by this kind of information, then your intellectual also get affected. In this model, if any forces get affected by anything, that will make a difference in a whole structure basically. So if we shift any single thing in the mind or in this force model, that will give a benefit to whole structure.
How to do that, madam?
Sorry.
मैं इसको बताता हूँ। हिना मैडम, ये इन्होंने चैट बॉक्स में भी लिखा था, he wants to know the process which you will tell in next session. Possibly we will demonstrate how you have benefited person with neurodivergence, because lot of questions have come which you are possibly going to answer in next session, which
Okay.
is demonstrating by example that how it works for person with autism and other neurodivergence. Till
Okay.
now it was a theory part, so people are getting confused what is the practical part.
Okay. So they are asking me ki how can we apply this model to these children, right?
Right.
Exactly.
Okay, so now we'll move to next part. Before moving to next part, I'll just make sure that everyone is available here with the Google form. I'll just spotlight myself for everyone. I'll paste Google form link in the chat box. Dr. Heena is taking sessions for person with neurodivergence, autism, intellectual disabilities, Down syndrome, and cerebral palsy, schizophrenic. And certainly she's sitting in Raipur and she takes session online. And this is certainly wonderful, which I have observed. I'll paste a Google form where you will answer some questions. And by the end of the next session, which will end at around 12:20, I would certainly see some answers, and same way we can go ahead. There is a session where we'll give 5 person who will fill first, will get first one-on-one session free of cost to Dr. Heena. And later on, how it will go ahead, we want to train many more person with the parents also, therapists also on this, because this certainly new. This is combination of eclectic approach. Nutrition is there, spiritual is there, and behavior therapy, speech therapy, everything. So that is how this will go. I'll just keep on posting the Google form link in the chat box. You keep on filling that while you are listening next session. Dr. Heena, anything else you want to add?
No, that's fine, sir.
Okay, right now you can start your next session.
Okay.
I want to add one thing.
Yes.
I want to add one thing, madam. This is a great approach, and even if it works 10%, it will be a great service to the humankind. So, I wholeheartedly support you, because I used to think of it. I used to hear that only conscious mind is we use it 10%. And I used to think that how we can increase this subconscious mind in these children so that they can become almost normal. So you have given me, first time I am hearing you saying that, and it will be a great service to the humankind. Thanks a lot.
जी,
हाँ, ये राजेश्वरी जी, आप कुछ कहना चाह रही हैं? राजेश्वरी जी, हाँ. Your signal is weak, I'd say.
या हाँ, अभी आप सुन पा रहे हैं?
हाँ, right.
जी, कहिए.
हाँ, नमस्कार मैडम.
नमस्कार.
हाँ, I want to know, in case of ADHD, we find out that this conscious mind, as you say, and it is a confusion of everything and all, we find that there are so many things already in the mind due to which the person behaves in a different manner when he or she communicates with the person. Okay? So, ये सब चीज को करने के लिए आप जो बता रहे हैं कि next week में आप बताएंगे how to solve these things and all. So, can we know these things in the next session, or before that, shall I have a consultation with you?
और नेक्स्ट सेशन नेक्स्ट वीक नहीं होगा, अभी जस्ट होगा, 5 मिनट बाद होने वाला है.
अच्छा, ओके, राइट, ओके,
ठीक है, ओके.
अब बजरंग लाल जी तुमानी.
Sir ji, I want to ask whether if we work on subconscious and conscious mind, then thinking, if we change thinking, then it will be better. Correct or wrong?
Sorry, sir, your voice
Madam?
is breaking down.
You see, मैं ये पूछ रहा हूँ कि सबकॉन्शियस माइंड और सबकॉन्शियस माइंड में अगर हम थिंकिंग को चेंज करें तो क्या इट विल बी बेटर?
Yes, it's always a better.
So we'll move to next session. While I have posted the Google form, everyone fill the Google form. This Google form is conditional Google form. If you answer the way you answer, it will move to other section. So you first 5 will get opportunity to interact with Dr. Heena free of cost. Let the rest have to pay the interaction, the session fees also, which is mentioned in the form. So we'll move to next session.
Next session is just 10 minutes. You just go through that, how we are clinically this using, and what kind of questions you have, because everything we cannot see physically, but just a certain aspect, what the physically we can change, we just discuss in 10 minutes and then we will discuss. That's a better idea.
Yes, yes.
Okay. Just a second. Let
अभी आप हमने कॉन्वर्ट कर सकते हैं. You want to share something?
So we are going fast for this video presentation, how we are applying clinically, basically, the uses of 24 elements Vedic model in a neurodiverse children. Okay. And look, this girl is having a squint eye by birth and a little bit of behavioral issue, but parents do not have any idea of this, and they have connected with me with spiritual basis only, and that eyes we have balanced by using a 24 elements Vedic model, and there are a lot of behavioral changes and the speech is changed in this girl. And in vision, we do for a color space, numbers, muscles, imbalance of depth perception, and every kind of vision perception we can be shift by using this model. And that vision perception is get corrected. This girl is never used to fix the 9 number in a proper manner. After just giving a single sessions, she is now able to manage this 9 number in a proper manner. Otherwise, it was 9 number is very difficult for her, and she avoid this exercise because she is not able to understand the number 9 in a proper manner. So this kind of problem also we can resolve and change by this model. And the muscles, sometimes these muscles
डॉक्टर ने
are
आपने कुछ शेयर तो नहीं किया ना? अभी कोई स्क्रीन पे कुछ शेयर नहीं हो रहा है.
शेयर नहीं हो रहा है?
अभी कुछ नहीं शेयर हो रहा है.
ओहो, ओके.
No.
No? Okay. Now it's visible?
Yes.
Okay. So 24 elements Vedic model, that's in neurodiverse children. And this is the vision we have shifted. It's the eye muscles get distorted in this girl, and she has connected with me on a spiritual basis only. And after doing a certain sessions, her behavior and speech, everything shifted along with that eyes. Only a single system is affected in this girl, and that was distorting her total behavior and the speech development. So by using this model, we have shifted that muscles, and that now you can see that eyes is normal because muscles are very well balanced, and that has balanced her behavior and speech. And this is the vision perception. This girl was never able to fix this 9 number, and because of that she gets frustrated and she avoid the activity. After doing these sessions, and again we check with this number, it's now very easy for her to do, and now she's asking for the activity because she is able to solve this puzzle. And these all are the muscles problem. Particularly, we find in a genetic disorders these kind of muscles. And children with ADHD and autism, we find these kind of muscles and your scapular force are not working properly, and they are having a writing issues. So we need to work on these muscles, and these all are the sensory muscles. So we need to fix the sensory system. If we fix the sensory system, this muscle come online for work, and then the whole writing is generated. And the sound clearance, some sound is not clear. The speech is very excellent in a child, but certain kind of sound is the problem. At that time, we use this method, and nowadays we are developing other model for the learning disability. And in this kind of children's, they are not able to make the spellings basically. So their hearing and visions are not working in an integrated fashion, able to build a word and sentences, and it's a great problem in a learning disability like behavior in autism. So we can clear that forces of word. We are using a lot of sounds in this exercise, and we clear all the negative experiences or emotions they have holded in that words and vision. And after that correcting, they can make a nice word, and they can able to make a sentence basically. And stuttering of the speech, and sometimes even our children's also certain kind of words they are not able to produce. They are clearly indicating that there is some stress is holded at that area. If we clear that, that can shift that behavior and sounds, and even sometimes the better clarity of the speech. And this is the vestibular system, and vestibular system is needed for a balance basically to run and to actively participate on a physical level. If we do not have a proper balance, sometimes it's very difficult for a child to participate in a day-to-day activities. And this system is connected with the eyes, sensory system, major sensory system is there. And this is the vestibular system. These both the system must work in an integrated fashion. Then only we can do a greater physical activity. And this is the video of the vestibular system. We have evaluated this day of evaluation where she is not able to stand on a movable base. And she is just stuck, and this is the phase response in her vestibular system. Side view of the same day video. How much she is bended. Same day, she is little bit relaxed and able to see right and left. This is, we have done one session. This is the second day session of correction. She is quite better. Body is relaxed. And she was avoiding, and nowadays she comes, she takes everything, and she just start herself. She is that much relaxed from first day to now. She is not avoiding it, and her motor system is working, her posture is improved, and that improve her vision. Then she is having a more better sensory integration, and that help us for a better cognitive development. So each and everything is important. Whatever your issue, that we find it out and we can work according to it. And this all kind of behavioral action, behavioral shift anywhere, whenever we change any system, sensory, motor or anything, that shift your behavior. And this is the unorganized behavior. We have used exercise and as well as this model. This indicate make the mind is destructive basically. He don't know how to play with the toys even. And after doing some sessions, he is very well organized. He started playing, learning, and he is very calm. He understood that how to play with the toys, and that kind of concept, that's cognitive development on a very primary level child start doing basically. And along with that, as he calmed down, his sound also start coming, and that has produced many words within a 3 weeks program only. Okay, and this is our epigenetics that's genetically involved, that our genes are also having a memory, and that memory is affecting us. So we sometimes need to release this genetic memory, and that help us to shape our behavior. And nutrition and stress, particular nutrition under the stress like protein, vitamins, mineral, many more things can be corrected. Immunity, constipation or breathing issue, etc. So whatever your problem, we will discuss and we will plan how can we help you with this model. Okay, so this is my last slide sharing, and then we will go for a discussion or whatever the Anurag sir will having a planning for the further session. Hello.
I will unmute everyone. They
Okay.
can unmute themselves and then ask. In case someone has filled the form, then they can raise the hand. Immediately, I cannot watch who has filled the first. Yeah, Rajeshri ji is trying to say something. I think Rajeshri ji आप पहले कन्वर्ट करें, फिर दिवाकर जी आपको करते हैं काम. राजेश्वरी जी आप कन्वर्ट करें.
सर मैंने फॉर्म तो फिलअप कर दिया है. लास्ट में आया था पे 500, मैंने पे तो नहीं किया है.
हाँ,
तो आप देखिए
तो कुछ ऐसा किया होगा कि आप उसमें चली गई. अदरवाइज इट इज आल्सो फ्री. In case you fill the right way, though it will go to a questionnaire. Anyway, I'll just post the link of first those who can fill the Calendly form, Google form. They will get the Zoom link. I'll just post here so that anyone can do it. Here it will also capture basic information. I have just posted Calendly form in the chat box. You can fill that. So 3 or more are required. They will get free opportunity to talk to Dr. Heena Patel. So anything else you want to ask? Sushma ji, you wanted to know something? आपने कुछ chat box में बोला था.
Hello.
जी.
Yeah, ma'am. I have an autistic son. So actually, I didn't understand how will you work on them so that everything will be in order. Like what is the process? How will you do? Ma'am, you're in mute.
ना आप म्यूट में हैं.
Hello. Now it's audible?
Yes.
Okay. So you want to understand the process of it. Look, that first session, why we are giving that, we need to understand the problem of the child, and then we decide the approach how can we help the child. And this is the energy model. It's not the physical model. So sometimes it's difficult for people to understand, but it's nothing that on a principle of Vedas or quantum physics. Hello?
Yeah, wait a minute. I'll just mute. किसका गड़बड़ है? एक मिनट. हाँ, आप चालू करिए.
Hello?
Yeah, it is okay now.
Okay. So how can we apply that? First, we need to understand the problem of the child. We identify the problem, and then it's the energy model basically. So healing, anyone has done any kind of healing, the same way it will work, but it is the diagnostic where the problem is there. We are cleaning that energy patterns, and that clean your mind, and that help the child basically.
Do you mean like EFT tapping like that, ma'am?
Sorry?
Do you mean like emotional frequency technique, EFT tapping or something like that?
No,
Or
24 elements Vedic model is itself a technique.
okay.
So we understand the force, and I am using lots of tools basically to clean that force. So the techniques I cannot describe. Okay, what kind of technique it is there? Emotional. It's not. We need to clear that force basically. Whether that emotion is picked up when you have conceived, whether it is a genetic, whether the child during a pregnancy, you can say this is
I
not
mean,
just the
if you
emotion.
can,
And
if you can
first
tell,
understand 24 elements Vedic model is a software basically. And in our children, that software is damaged. And what the emotions and energy people are using in a healing therapy, that
Unmute just
Yeah.
like, can you just give a small, like, brief thing, like what, how it will means what work you will do, that I didn't understand, ma'am. Maybe many of our parents didn't understand what you will do. I'm not telling you to tell your techniques and all, but at least brief a few points so that we can understand.
look that we use a biofeedback system to find out the process basically. And for the techniques in Raipur, I am already doing a physical workshop. If anyone, that's the level primary one only. This is the techniques you can say for anyone has used a Reiki or something kind of any kind of modality in healing therapies.
Yes, ma'am, I did chakra healing.
Okay, you have done. It's a distance or on a physical level.
Both.
Both. Okay, so distance you understand.
Yes, ma'am.
Okay, okay. So distance, you understand that in this, what happened there, here we use the quantum physics phenomena that whenever I focus on any particle, it starts shifting. The same method we use, but in 20, what is the difference between 24 elements Vedic model and another energy? Understood that the 24 elements is the software of you, how you are running. And in mobile, you are downloading a picture, you are downloading a files, you are downloading a videos or something like that. If viruses come, let's say for some example, it's like your app or your picture or video is damaging that your working system. So it's very easy to manage. Are you getting me?
Yes, ma'am.
Hello, are you getting me? Hello?
I think she said yes.
Okay.
Ma'am,
Okay,
I think
and now the
you were saying
software is
first you will
damaged. Say, for example, the software in a mobile, the same way 24 elements Vedic model is a software. If it is damaged, then people are not working on the damaged forces. Only Veda has given this structure. So we need to fix this software, not the viruses. So this is the difference between 24 elements and the difference between other healing therapies. So we are fixing this structure basically. If you fix the structure, then a lot of things will get corrected because your software is already working in a better manner. If the viruses are there, then it's very easy for us to release from your system by 24 elements. But when the force is damaged at that time, it's very difficult for the people because I have used many techniques. I have trained for other healing techniques also, but it has not helped me to work clinically within my children. So that's why I have developed this model. Yes, good morning. Yes, I can hear you.
So this technique is somewhat like the Reiki technique. I mean, not
Application of technique is a Reiki because they are also using energy techniques, and I am also using energy, but we have used the principle of this psychology and other things, how the neurology is not working, where it is not working, nutrition is not working, what it is not working, that's the perfectly diagnostic, and we use a biofeedback testing also. So that is the difference between the Reiki and this modality. Reiki only work on energy, but we are working on a many component. That's nutrition. I am saying you, we are working on a software. Software, I think nobody is working on a software.
So there will be a testing also. I mean,
Yes,
all
it
the
is. Yes,
like you
yes,
said.
it is a testing also.
Okay. And approximately, like, how long does this take? This working?
That depends on the how the damage force is basically.
Okay.
Okay, so this is the layers. How many experiences you have gathered layer by layer. So if the experience are more, then we need to clear all the layers, or sometimes it's a 4 to 5 or sessions, or generally we say for a 3 months, that's 15 to 20 sessions you need to wait to shift basically, or sometimes we find in a 5 to 10 sessions that parents are saying that they are shifted. And if the child is in front of me, then we can easily catch up. That I show you that within a single session, that reversal of 9 numbers, you always try to fix in an inverted manner. We have just shifted that force, and within a single session, she understood that how to fix this 9 number on a plate. So sometimes it's a single session phenomena also.
Okay. So what testing and all is to be done that you will be saying?
That I will do whenever I use a methods. At that time, I will check out the what force is not working, why it is not working, and then we will clear it.
No. You said some testing method also needs to be done. What I understood was some physical testing, like a blood test and all will be needed.
It's energy testing.
Energy testing. So you will be doing from your side.
Yes, yes.
Okay. And does this help adult children also? Like
Anyone, it can help to any human being, anyone.
Okay. And will sir be telling us approximate cost of all this, or how you will be telling us? How will we know? I mean,
That's documents.
plan.
Sir has given a Google form that you fill it that up, because 5 sessions we are giving a free for consultation, and afterward it's a chargeable. And reason behind it that the you know that therapy is a time consuming method. So whenever we spend,
So it has to be charged. It is not like that, but like approximate idea if we get, no, then
I'm not getting you. What you are asking me?
I mean the charges for each session. How will it be?
That will Anurag sir will convey all the messages to you.
Okay.
First,
Thank
you
you
fill
so
the
much.
form.
Yeah.
Try to get within first 5, so that you get it opportunity to interact.
Okay, thank you.
After that, in case you are not on first 5, there is a 500 rupees charge. And in case you, after the interaction, you find it comfortable, that you, first thing is that you should believe on this. Without trust and belief, nothing will work. So in case,
Sir. Actually, what ma'am is saying, what doctor is saying is very true. It is a lot of all those forces only. We believe in all that.
yes.
But still, many other things are also there, which external things.
After that, in case you agree on this, that if you are confident that there will be some changes, we'll give you another web link, which is through our approach autism site, and you can fill that form. There'll be normally it is 30 session, 20 session, and 10 session form. So you can opt for anything, and then we'll go ahead. And after that, if you find that it is your son is recovering, or there's a better result, then you can opt for another sessions, another 20 or 30 sessions. Normally it takes 20 or 30 sessions to recover from any behavior therapy. Any therapy takes so many sessions. So I believe that this much time it should also take to recover. Even I feel that my son is also we have also tried Reiki and all, and changes have happened, but it was not consistent. It was not for a long time. As soon as we stop, it again regresses. So I believe this our 24 Vedic model will certainly help everyone. That is how we got interaction with Dr. Heena, and I found that this is certainly something new, which can help a lot of people, where any therapies, any medicines are very tempting.
Actually, why I'm sorry to interrupt.
Yes.
Why I feel that like what she is saying, there is a lot of conviction in that, because like she said, all the 5 sense organs, then all the feelings and the subconscious, everything is interrelated, and
Yes. Yes, everything is interconnected.
and what we see is these are the ones which are causing little problems for our children. Otherwise, they are very, very, especially if I have to talk about my son, he is very good, quite good in many things. Whatever we teach, he's willing to learn, everything is there. But certain sensory issues are there, which causes problems.
That concept we has given a name of sensory psychology, but that
Ah,
is for the professional people when we trained it basically. Because I am also trained in a sensory integration therapy, but I was not satisfied because I was not getting an answer with that therapeutic model.
no,
But
ma'am. What I have seen, sorry to interrupt, is those sensory therapy things, they don't actually work out. What works out with my son is when we sat with him, when we spoke to him, many of the things he understood, and mm, we helped him with certain things like you try this way out, that way out, and he was willing to learn, and it really helped also. So more than
yes,
the therapy, it is the mind which needs that, like you said, the subconscious mind.
yes. So we need to clear the mind basically, and that mind is affecting a sensory system. At that time, your sensory system come back again whenever it gets that kind of environment. That's what I was saying basically. So you need to erase the total from this all these forces. Every memory, every layer you need to release. Then and then only we will get the results basically. Hello.
So replacing that is possible? You mean,
Yes,
uh,
yes, it is possible. It's a kind of language. We need to replace it.
okay.
Yes.
Good morning, madam. This is Srinivas from Vizag.
Yes.
My kid is 9 years old, boy.
Yes.
He's having a speech delay.
Okay.
As in today, he is speak only single word, and is autism also having.
Sir, please speak loudly little bit.
He is having autism also.
Okay.
He's a student, and his studies are very lagging, and he's not sitting properly and writing the letters.
Okay.
So, what kind of way we can approach?
Sir, I initially told that do not directly jump for the speech and this education. Whatever the possible way, we need to correct this structure first, and then automatically child will go for this higher mind will go in higher cognition, and gradually it will give you fruit in form of speech and in form of education and this kind. So we need to find out what is stopping him for proceeding further basically. So first we need to evaluate the things, what is stopping him and what is preventing him to give a better solution for it.
Further evaluation only I'm asking. I am not asking about only studies. The behaviors we found in their home. The speech delay is the major problem.
Speech delay is major, but he's speaking the words.
Our home general words only is speaking.
Okay,
Mother,
so
father, brother, and recognizing the some provisions and eating food, and he will do
Okay.
all his personal works individually.
Okay, so by this model, what we will do, we will clear these forces, whatever the holding, how it work. Look, that if your mobile is full with 80-90% of memory at that time, we cannot feed a new memories in them. Whether it is in form of a word and speech or other kind of things, basically. So we just we are just going to make the space and that space will help you to produce a certain new learning within him, and that will help him to develop a more speech basically.
Okay. Okay.
Okay.
Just request you, Srinivasanji, you fill the form. I will come to know a lot of things about your son so that the interaction with Dr. Heena goes smoothly. This session, she has taken time till 12:30, and the session is going to come. We are going to finish this session. Form is there on the chat box, and the same thing will be there in the cognitive wellness group. If you have applied, you have joined cognitive wellness group, then it is okay. Otherwise, I can give you the link of cognitive wellness group in the Zoom link. Hold a minute. Where Zoom has gone.
Yeah, I did completed also. The form is completed.
Okay.
And I'll note down the mobile number also. And
this is chat WhatsApp group cognitive wellness, where you can join immediately so that you don't miss any information. I'll keep on posting lot of things about these sessions. I'll keep on posting live streaming YouTube link. I'll keep posting the edited version of this. I will answer all the chat which is there in the chat box by tonight, so you will not miss anything.
Okay, sure. Thank you for.
Okay, and Nidhi is available.
I think she mentioned that she has done quantum physics, something like that.
Yes. She is a physicist. If she is present, then please come forward.
It is for me, madam.
Nidhi.
No, she is not there.
She is not there. Okay.
Nidhi is not there.
Madam, I have a question.
Yes.
Hi, this is Malay.
Yes.
So my question is pertaining to my daughter who underwent a brain surgery due to her condition. And is this 24 Vedic element model? Because this is an energy related treatment, right?
Yes.
So is this applicable to children who underwent surgery, and is it beneficial for them, or can it cause more issues?
Yeah, it is beneficial for that, but I need to understand what kind of surgery he or she has gone, and we can apply it. I already told you that the head injury patients, sometimes it was a physical trauma, and it was a certain kind of that disturbed their energy, and by using this method, they get benefit of it. So surgery we can apply basically. Sometimes that is the different thing that sometimes the stitching or whatever the process has done on a body, that also body memorize that things also. So sometimes we need to release that physical part also, and that will help open up the channel for person basically, and that we call this surgery, or particularly we use it in this CS sections, and there is a full front channel in front of us, and because of C sections, many ladies they feel that they are having a back pain or certain kind of things, and it's not get healed by a general physical therapy. At that time, we just work on their C sections by this model, and their muscles come back online, and they are having no back pain. So there are a lot of example of it. We need to work on a physical level also. Hello?
Yeah, I did understand that, because we have tried other types of healing and everything, and some of them cause side effects. So that is why I just wanted to be sure.
Okay. You just fill up the form, and then we will discuss in detail what your problem is and what kind of side effect have you received, and then we can decide how can we help the child.
Definitely. Thank you.
Okay.
So you suggest medications also, ma'am?
No, in holistic we don't suggest medication,
No medicines.
but what we do, nutrition and these herbs I suggest when it is helpful to a child.
That is right.
Hello, madam.
Hello?
I am Divakar. She is my daughter, Dushi.
Yes?
Can you see her? Is it picture? No, it is partially blocking. Oh, blocking because of my hand. Sorry. So she is the one I was talking about. Her
Yes.
speech is a problem, and expression is a problem. So
Okay.
if she can get corrected, her
Yes,
this behavior can
expression
be
is.
corrected with
This
your
is
help of
the
your
problem of, yes, I understood that basically we are not able to express in a full manner. That is the problem in everyone basically.
Yes, yes.
But our children are having a more issue because they are not able to express even the basics things. So we can help that kind of issues.
Yes. So if you can help, then we would like to go even on payment basis. That will not be a problem. So you tell us the time when we can interact with you, and we are ready to take a few initial sessions with you.
Okay.
Sir ji, आप
I
form
filled the form. It is preliminary in the nature. I have filled most of the places nil, but you can when we interact, I will fill it
okay, no problem. It's okay.
in a much better form.
Yes.
Okay.
So we can help. We can help that way.
Thank you. Thank you.
Thank you. Okay. Anyone more? Anyone having a questions now?
One question from my side, ma'am.
Yes.
Is it like a session we have to visit over there, or it is like a virtual session only?
Look, that you just need to give me your problem on a first sessions, and it's not if the child is able to talk or communicate, then they can come virtually. Otherwise, just give me a problem. Whenever the session is there, it's kind of a energy work. I just entangle and just give a positive energy to that person, and that will work greatly on the child basically, because our child is not able to sit sometimes. They are not comfortable on screen sometimes, or they are not understanding the process. At that time, this method work powerfully. I just give me one example that I am having a friend. She's a doctor, and some of her auntie's daughter is having a problem, and she is in US basically, and they have consulted in the US like a lot of psychologists and a lot of things, psychiatrists, and they have done. And in psychology, there is a one method called cognitive behavior therapy, and that is the highest form of behavior management basically. But even though she is a normal person at the age of 44, and it is not working for her, and after that they have contacted me that the person is not able to take live therapy, then how can we help them? At that time, these methods help you a lot basically. So you do not have to come virtually and sit in front of me, because that's a communicative method, and sometimes it's a fail even in a normal person also. That's why we have developed this model, because our child is not able to explain anything to us. We need to find out what kind of behavior they are doing, and by first observation and communication with the parents, we understand the problem of the child, and then I have to find out what is not working in him. It's very difficult basically. It's not that easy, but when we have applied in this our clinic, and then we understand why he or she is behaving in such a manner, and now it's very easy for us to find out the problems, because whatever you are doing, that's the story around you is saying everything to us. So it's not you need to sit in front of me. You just say me your problem. Whenever I do a application, it's just a focus of on that person only, and that shift the energy of that person, and that is the quantum physics phenomena. I told that whenever you focus on a particles, and they start shifting basically, and it is research based, and it's done by a scientist. So I used a lot of science and keep reading and researching, so I can use a lot of things in my clinical practice basically, because I am a clinician. So I use the research of every people, and I use it in my clinic to develop these methods. And this is, I told that it is continuous evolving method. So whenever the research come, we keep upgrading our system. So 24 element Vedic model is not the fixed model. Whenever the
Okay.
research come, we keep evolving our methods also.
Okay, thank you very much, ma'am. But yeah, I would prefer that.
Oh, so Dr. Hina, Ravi Kant ji wants to talk to you.
Yes, please.
सॉरी रविकांत जी, आपको इतना देर वेट कराने के लिए।
हाँ मैम, मैं ये पूछना चाह रहा था, जैसे ये एनर्जी बेस्ड थेरेपी है,
हाँ,
तो जैसे इसमें तो बच्चे को वहाँ कंटिन्यूअस आपके निगरानी में रखना पड़ेगा ना, मतलब आपके मॉनिटरिंग, क्योंकि एनर्जी तो डिस्टर्ब होने से दिक्कत हो जाती है।
नहीं, इसमें जो आप मतलब पर्टिकुलरली किस बारे में बात कर रहे हैं ना, उसके ऊपर डिपेंड है कि एनवायरनमेंट में कोई इश्यू हुआ और एनर्जी जो डिस्टर्ब हो गई, वो दूसरी चीज है। और दूसरी चीज ये है कि अपने बच्चों की जो एनर्जी अनकॉन्शियसली डिस्टर्ब है, हम उस एनर्जी को पहले करेक्ट करेंगे ताकि उसका जो एनवायरनमेंट के साथ जो इंटरेक्शन नेगेटिव है ना, वो पॉजिटिविटी में कन्वर्ट हो पहले तो। और जो आप एनवायरनमेंट की बात कर रहे हैं ना, वो हम जो कॉन्शियस कनेक्शन करके एक और वेबिनियर करते हैं कि जिसमें आपको एनवायरनमेंट कैसे पॉजिटिव रखना है, बिहेवियर मतलब ये कनेक्शन बच्चों के साथ कैसे बनाना है, वो सारी चीज है ना, हम उसके अंदर भी क्लियर करते हैं। तो एनवायरनमेंट पॉजिटिव रखना है, उसके लिए भी थोड़ी बेसिक्स ट्रेनिंग्स ऑलरेडी हमने बना ली है, और साथ साथ में उसके जो प्रेजेंट इश्यूज हैं बिहेवियर के, वो इस मॉडल के थ्रू हम करेक्ट करते जाते हैं और एनवायरनमेंट से सपोर्ट करते जाते हैं।
मतलब बेसिकली आपका मैम कि ये जैसे आप बता रही हैं, तो जैसे
हाँ,
आपके यहाँ जो सेंटर पे हम लोग आएंगे अपने बच्चे, जैसे मेरा बच्चा ऑटिज्म है, अभी उसके थोड़ा सेंसरी प्रॉब्लम है और
हाँ,
स्पीच डिले भी है, तो जैसे
हाँ,
आपके सेंटर पे आएंगे तो मतलब जैसे आप जब सेशन लेंगी तब तो उस टाइम मान लीजिए आपके मॉनिटरिंग में रहेगा वो, जैसा भी आपका जो भी है।
हाँ,
अब मान
हाँ।
लीजिए हम तो कहीं जाएंगे, अगर ऐसे जो होटल होटल में रहेंगे वहां अगर वो डिस्टर्ब हुआ तो दिक्कत हो सकता है ना मैम, जैसे एनर्जी वाला चीज है।
नहीं, उसमें ऐसा कोई डिस्टरबेंस नहीं होता है।
ओके
जो इश्यू आप मुझे डिस्कस कर रहे हैं ना, हम उस इश्यू पे गोल सेट करके उसके ऊपर पहले वर्क करते हैं।
ओके
ठीक है। और जो डिस्टरबेंस आता है ना, जैसे डिस्टरबेंस तो है, इसी के लिए तो हम ये मेथड यूज कर रहे हैं। तो जो डिस्टरबेंस आ रहा है ना, तो वो एनवायरनमेंट से आ रहा है, इंटरनल है कि एक्सटर्नल है, वो हमें आइडेंटिफाई करना होता है। एक्सटर्नल अगर होता है तो हमें वो ट्रिगर ढूंढना है और कोशिश करना है कि एनवायरनमेंट पॉजिटिव रखें हम। और
ओके
अगर इंटरनल है तो हमको इसको इस मेथड से रिलीज करना पड़ेगा, क्योंकि वो ऑलरेडी इनबिल्ट है सिस्टम के अंदर।
ओके
तो वो उस हिसाब से काम कर रहा है। तो हमें ये ट्रिगर ढूंढना पड़ता है कि इंटरनल ट्रिगर है कि एक्सटर्नल ट्रिगर है।
ओके
एक्सटर्नल ट्रिगर है तो एनवायरनमेंट को हम अच्छा करेंगे, और इंटरनल ट्रिगर है तो इसको हम ये इस मेथड से रिलीज करेंगे। फिर क्या करता है कि दोनों चीजों को कॉम्बिनेशन में चलाना है हमको, कि
ओके
हो सके उतना एनवायरनमेंट पॉजिटिव रखना है। ट्रिगर जहां पे हमें पहले से पता है कि ये चीज इसको ट्रिगर करिए, तो कोशिश करेंगे कि हम उसको कैसे मैनेज कर सकते हैं। और
ओके
इंटरनल ट्रिगर हम कम करने से क्या है कि उसका जो कैपेसिटी है एनवायरनमेंट के साथ इंटरेक्ट करने की, वो बढ़ेगी। तो उससे क्या होगा कि जो पहले ट्रिगर होता है बच्चा, वो ट्रिगर भी उसका जो है ना, वो कई बार कम हो जाता है या तो पूरा वैनिश हो जाता है ग्रेजुअली।
ओके
तो वो उस हिसाब से कॉम्बिनेशन में चलता है, क्योंकि हम इंटरेक्शन तो एनवायरनमेंट के साथ करते हैं, और ट्रिगर कहीं से भी हो सकता है। ट्रिगर इंटरनल भी हो सकता है, ट्रिगर एक्सटर्नल भी हो सकता है।
मैम एक चीज और पूछना था, जैसे आपका सेशन कंटिन्यूअस चलता है या अल्टरनेट, एक दिन के बाद या 2 दिन के बाद ऐसा?
ये अल्टरनेट वीक में 3 डेज हम सेशन करते हैं।
अच्छा, 3 days a week।
हाँ,
रविकांत जी, मेरा सजेशन ये है कि आप 22 को
ओके
अपना अपना कॉन्शियस कनेक्शन वर्कशॉप है जिसके लिए आपने फॉर्म भरा है,
ओके
उसको अटेंड कर लीजिए, तो उसके बाद आपको काफी क्लैरिटी हो जाएगी आपको फिजिकली रायपुर जाना है या फिर अपनी जगह। आप कहाँ पे बेस्ड हैं?
मैं फिलहाल आसनसोल में हूँ, लेकिन मेरा बच्चा अभी पटना में है, वहाँ वो थेरेपी करा रहा है, स्पीच थेरेपी की।
हाँ हाँ
तो आप उसके बाद डिसाइड कर सकते हैं कि आपको रायपुर आना जरूरी है या फिर वहां से भी काम हो सकता है।
ओके, थैंक यू सर।
तो
थैंक्स
इसी
सर।
तरह से जो लोगों ने भर दिया, आई एम नॉट श्योर हाउ मेनी पीपल हैव फिल्ड, वी कैन नॉट engage more than 10 in on this 22nd 22nd को 9:30 पे हम लोग कॉन्शियस कनेक्शन का एक छोटा सा वर्कशॉप रखेंगे। उसके बाद जब डॉक्टर हिना का अगर किसी को मतलब ये फीलिंग आती है कि नाउ ही कैन गो अहेड, तो डॉक्टर हिना का सेशन 1-on-1 का भी है, वो भी प्लान कर सकते हैं।
ओके, थैंक यू सर।
जी, एनीवन एल्स वांट टू आस्क एनी क्वेश्चन? और ये चीजें जो आज अभी सेशन चल रहा है ये यूट्यूब लाइव में है, मैंने लिंक भी डाल दिया है। कुछ चीजें मिस हो गई किसी को, तो वो उसमें जाकर क्वेश्चन पूछ सकता है। मैं लिंक को दोबारा डाल रहा हूँ यूट्यूब लाइव का, वो उसमें जाकर दोबारा उसको देख सकता है। और जो कॉन्शियस कनेक्शन का मैंने एक लिंक दिया है रोजर पे का, इसके चार्जेस हैं 99 रुपीज। 99 रुपीज इसलिए कि हम चाहते हैं उस दिन सीरियस प्लेयर आए, अदरवाइज हम सब कुछ फ्री भी कर सकते थे, लेकिन सीरियस प्लेयर आए। 99 रुपीज कोई बहुत बड़ा रकम नहीं होता है, लेकिन इतना छोटा भी नहीं होता कि लोग भूल जाएं, तो इसलिए उसको रखा है।
सर उस दिन जो ये जो मीटिंग होगा वर्कशॉप का, उस दिन उसी दिन आप पोस्ट कीजिएगा वो लिंक।
मैं आपको उसका लिंक आपके फोन पे आ जाएगा।
ओके सर, थैंक यू।
जूम का लिंक आपका, आपने सब फोन
ये
नंबर वगैरह भरा है,
शशिकांत
फोन
सर से
नंबर।
मैं एक बार और बात करना चाहूंगी।
हाँ जी, जी मैम।
जी सर, आप फिजिकली जो बोल रहे हैं कि रायपुर आके करूंगा, तो उतना एफर्ट्स आप मत डालिए, क्योंकि हमारे काफी सेशंस ऑनलाइन चलते हैं। ये जो एनर्जी वाला सेशंस तो हम कर ही रहे हैं, इसके अलावा भी थेरेपी सेशंस भी चलते हैं। तो उसमें जहाँ पे आपका जैसा नीड होता है ना, वैसा बहुत सारी चीजें आप आराम से कर सकते हो। तो जैसे सर ने बताया ना, वैसे ही कि पहले आप अटेंड करो, या एक कंसल्टेशन भी आप ले सकते हो, जिसमें 1-to-1 आपका जो भी क्वेरीज है या बच्चे को दिखाना चाहते हो बिहेवियर वगैरह, आप ले सकते हो। और उसके बाद आराम से डिसाइड करो, आपको बहुत इजीली हेल्प कर सके ना, वो हमारा एम है बेसिकली, कि हम कैसे मैक्सिमम फॉर्म में और आपके लीस्ट एफर्ट में आपको हेल्प कर पाएंगे।
जी मैम।
ठीक है, तो ये हमारा पर्पस है। तो आप बिल्कुल उसका फिजिकल ही आना है और ऐसे करना है। नीड होगी तो डेफिनेटली अगर आप एफर्ट्स कर सकते हैं तो जरूर करें, पर अगर वहीं से मैनेज हो सकता है तो हम बेस्ट ट्राई करेंगे फैमिली के साथ ही रहे और आपका प्रॉब्लम हम सॉर्ट आउट कर पाए।
जी मैम, थैंक।
ठीक है जी जी।
किसी और को कुछ क्वेश्चन पूछना है? वी आर गेटिंग लेट। डॉक्टर हिना ने अभी अपना क्लिनिक से आई है, तो इसलिए आई वांट हर टू गेट रिलीफ फास्टर।
एनीबडी वांट टू आस्क एनी क्वेश्चंस?
ठीक है, जिसको भी टच में रहना है, कॉग्निटिव वेलनेस ग्रुप में मेरा ख्याल है सब लोग हैं, और सब लोग उसके थ्रू हमसे टच में रह सकते हैं, क्योंकि लिंक तो मैंने सिर्फ कॉग्निटिव वेलनेस ग्रुप में दिया है। बाकी ये यूट्यूब लाइव हो रहा है, ये मैंने सब काफी जगह डाला हुआ है। आपके पास रोजर पे का एक लिंक आ गया है, जो मैंने 2-3 बार डाल चुका हूँ ग्रुप में, चैट बॉक्स में, और ये मैं डाल दूंगा अपने इसमें भी। अपने राजा भंडारी जी, आप क्या उदयपुर से हैं क्या? राजा जी, चलिए अच्छा। तो वो चैट बॉक्स में डाल दिया है, और साथ में कॉग्निटिव वेलनेस ग्रुप में भी डाल दूंगा 2-3 बार, जिससे कि आपको, आप लोग 22nd में 5 मिनिमम और 10 मैक्सिमम पार्टिसिपेंट्स रहेंगे, तो एक सबकी अंडरस्टैंडिंग एक कॉमन लेवल पे डेवलप होती जाएगी। थैंक यू, थैंक यू फॉर बीइंग हियर। इतनी देर तक आप लोग ने वेट किया, 7:30 बजे से अभी 9 बजने वाले हैं, 9:09 हो गए हैं, और लगभग 1.5 घंटे से ऊपर का ये वेबिनार था। और थैंक्स फॉर पार्टिसिपेटिंग। थैंक यू।
थैंक यू एवरीवन, थैंक यू।
थैंक यू डॉक्टर हिना फॉर गिविंग अस सच ए वंडरफुल सेशन। और जितनी
थैंक यू,
बार
थैंक
भी
यू
मैं आपके सेशन में शामिल होता हूँ, मुझे बड़ा और ज्यादा एनर्जी भर जाती है।
जी, थैंक यू।